It may be a surprise to learn that injury is the leading cause of death for British Columbians ages 1 to 44 years, placing a huge social and economic burden on the province and its citizens. However, it has been demonstrated that when sustained resources are available and collaborative efforts using multiple strategies are applied, injuries can be prevented. This presentation makes the case for injury prevention in British Columbia, and the need for action is compelling. Over 2,000 British Columbians die each year from injury. Nearly 35,000 are hospitalized, and almost 500,000 require emergency medical attention because of injury. Many are left with a permanent disability, affecting them for the rest of their lives and placing a continuing burden on family, friends, and the healthcare system. Most are young and in their most productive years. The potential lost in contributions to society and the economy is huge. Preventable years of life lost estimates the average number of years a person would have lived if she or he had not died due to a preventable cause of death. When we compare preventable causes of death, injury leads. It's well ahead of other preventable causes like heart disease and cancer. The overall cost of injuries in British Columbia is some $3.7 billion. This is a staggering amount of money spent on injury each year. Yet, the vast majority, up to 80 or 90% of injuries, are entirely preventable. And if 80 to 90% of the costs of injuries were saved, it would amount to a considerable sum of money that could be used for other areas of the healthcare system. While it is important to recognize that resources will be required to embark upon injury prevention interventions, the investment is relatively modest when compared to other health interventions such as surgery, hospital care, and rehabilitation. Investment in injury prevention pays big dividends. For example, each dollar invested in a child-resistant cigarette lighter saves society some $80. A dollar invested in a bicycle helmet saves up to $45, and booster seats return $71 on each dollar spent. The good news is that injury rates in general are decreasing in British Columbia. However, too many citizens are still injured, and there is still much to do to improve the safety and well-being of British Columbians at home, at work, at play, at school, and on the journeys in between. Modest, sustained resources to support collaborative efforts in injury prevention are needed. It is time to work together to implement evidence-based solutions that prevent injuries so that British Columbians can live long lives to the fullest.